Hello and welcome to the Healthcare Motivational Channel. This channel exists to honor and uplift you because your dedication and hard work is inspiring. If you find value in this message, please like, subscribe, and share this video with a colleague to encourage and uplift them as they care for others. Today's topic is about controlling your time when caring for patients. In the fast-paced world of healthcare, time isn't just a concept. It's a critical determinant of patient safety and the overall quality of care. Every second counts, and the effective management of time can be the difference between a positive outcome and a potential crisis. Every minute on a shift is an opportunity to provide care, to connect with patients, and to make a meaningful impact on their lives. It's a chance to administer medications, monitor vital signs, and offer comfort and support during challenging times. But relentless demands, constant interruptions, and the inherent chaos of a healthcare environment make time management a daily battle. Healthcare professionals are constantly juggling multiple tasks, prioritizing urgent needs, and responding to unexpected emergencies. This isn't just about efficiency or ticking off boxes on a to-do list. It's fundamentally about the quality and safety of care that we provide to our patients. Effective time management allows us to deliver comprehensive, attentive, and safe care. Lost time, whether due to disorganization, interruptions, or systemic inefficiencies, directly increases the risk of errors and potential harm to patients. Delays in treatment, misdiagnoses, and medication errors can all be traced back to poor time management. Time management in healthcare is not just a personal skill or an individual responsibility. It's deeply shaped by the systems in place, the dynamics of the team, and the complex interactions with patients and their families. It requires a collaborative effort and a supportive environment to truly thrive. Some patient encounters inevitably stretch far beyond their originally planned scope, often due to patient anxiety, complex medical histories, or simple misunderstandings, all of which can derail carefully planned schedules. The challenge lies in managing these unpredictable moments with grace and efficiency, without ever losing sight of compassion and empathy for the patient's needs. Mismanaged time can quickly lead to delayed medications, potentially compromising patient outcomes and increasing the risk of adverse events. It can also result in missed symptoms, subtle but crucial indicators of a patient's deteriorating condition that might otherwise be detected with timely monitoring. And ultimately, it can lead to overlooked changes in a patient's overall condition, preventing timely interventions and potentially leading to serious complications. The system's ever-increasing administrative burdens often exacerbate these challenges, adding layers of complexity and taking valuable time away from direct patient care. We are constantly being asked to do more with less, to stretch our resources further, and to navigate an increasingly complex healthcare landscape. Therefore, reclaiming control over our time is not just a matter of personal efficiency. It's a professional necessity, a critical component of providing safe and effective care. It's about creating an environment where we can think clearly, prioritize effectively, and make sound clinical judgments under pressure. And ultimately, it's about focusing our attention and energy on what truly matters most, the well-being and safety of the patient in our care. By mastering our minutes and optimizing our time management skills, we can collectively build a safer, more efficient, and more compassionate system of care for all. This is the often unseen and unacknowledged battlefield where patient safety is either won through diligence and planning or lost through disorganization and neglect, one demanding shift at a time. The core challenge, the very essence of providing exceptional healthcare for healthcare professionals, from seasoned physicians to newly graduated nurses, is balancing empathy with efficiency. It's a delicate dance between providing compassionate care and managing the ever-present demands of a busy healthcare environment. Compassion and listening are central to healing. They are the cornerstones of building trust and understanding with patients. But strict time limits and constant demands, the relentless pressure to see more patients and complete tasks, create tension. This tension can lead to burnout and compromise the quality of care. Patients' needs for connection, their desire to be heard and understood, can turn brief check-ins into lengthy conversations. What starts as a simple question can quickly evolve into a deeper discussion about their fears, concerns, and overall well-being. Clinicians must decide when to set boundaries and when to listen, carefully weighing the needs of the individual against the needs of all their patients, knowing that what seems trivial could be significant. A seemingly minor complaint could be a key indicator of a more serious underlying condition. There's no one-size-fits-all solution. Healthcare is not a standardized process. Each situation requires judgment. Every patient is unique, and their care should reflect that. We can't apply factory line efficiency to patient care. Healthcare is not about churning out widgets. It's about caring for human beings. Instead, we need a nuanced approach, one that values both efficiency and empathy, recognizing underlying needs, paying attention to nonverbal cues and unspoken concerns, setting boundaries with kindness, being firm when necessary, but always maintaining a compassionate and respectful demeanor, and making every minute count. Utilizing time wisely to provide the best possible care within the given constraints. This isn't about being cold. It's not about sacrificing compassion for the sake of speed. It's about being professional and effective for all patients. It's about finding the sweet spot where empathy and efficiency coexist, ensuring that every patient receives the best possible care. Psychological frameworks like the theory of planned behavior help us manage patient interactions. This theory shows that behavior is driven by attitudes, social norms, and perceived control. In practice, clinicians can shape patient expectations by clearly communicating the plan for each interaction. For example, I'm here for the next 10 minutes to check your blood pressure and give your medication. I'll be back in an hour. Are there any urgent concerns now? This sets boundaries, gives structure, and allows patients to voice immediate needs. By managing intentions, we guide behavior, making interactions efficient and respectful for both patient and provider. Strategic time management is backed by data. Studies show nurses are interrupted every 10-15 minutes, increasing the risk of errors. Only a small fraction of clinicians' time is spent in direct patient care. Most is lost to documentation and system navigation. Every unnecessary delay creates a cascade, shrinking the window for meaningful care. Poor time management and constant interruptions also drive clinician burnout, which is linked to higher rates of medical errors. Protecting our time is essential for both patient safety and clinician well-being. The evidence is clear. Controlling our time is a core component of a safe, effective healthcare system. Sun Tzu's Art of War offers lessons for managing time in healthcare. The enemy isn't the patient, It's chaos and unpredictability. Preparation and strategy are key. Know the rhythm of your shift, when rounds happen, when the ward is busiest. Plan tasks around these patterns to create protected time for complex care. Set clear expectations with patients at the start of each encounter to reduce anxiety and prevent time-consuming behaviors. Bundle care. Combine tasks during each patient visit to minimize interruptions. This isn't about rushing, it's about being strategically efficient, turning chaos into opportunities for high-quality care. With a well-thought-out strategy in mind, it's time to move beyond theoretical planning. Let's delve into the practical tactics you can implement immediately. These tactics will help you effectively manage interactions, streamline your workflow, and ultimately protect your valuable time. One key skill is to gracefully signal the end of an encounter. This can be achieved with a warm, clear closing statement, something that leaves the patient feeling heard, but also signals the conversation's natural conclusion. For example, "I'll be back to check on you at 2 p.m. This sets expectations and provides a clear time frame. Pair this verbal cue with physical cues, reinforcing the message non-verbally. This could be something as simple as organizing supplies, or subtly stepping toward the door, indicating your readiness to move on to the next task. Another crucial tactic is to redirect non-urgent questions. Direct these questions to the appropriate team member, someone who is better equipped to handle the specific inquiry. For instance, the dietitian can answer that this afternoon, but right now I need to give your antibiotic. This acknowledges the patient's concern while prioritizing immediate needs. Remember, these tactics aren't about avoiding patients or neglecting their concerns. They're about structuring interactions in a way that promotes efficient and effective care. This ensures that you can provide the best possible care to every patient without sacrificing your own well-being. By setting clear agendas, utilizing effective closing statements, and skillfully redirecting non-essential queries, we ensure that all patients' needs are met in a timely and comprehensive manner. This allows us to end our shifts feeling accomplished, knowing we've made a difference, and not utterly exhausted. Thank you for tuning into the Healthcare Motivation channel. If today's message inspired you, please click like and subscribe key. Share this video with a fellow colleague or caregiver to encourage them and help them feel supported on their mission of caring for others. Stay motivated, stay focused, and click on the video posted here. We'll see you in the next video.